Hello, everyone. It's Dr. O here, and today we're going to be talking about common causes of knee pain. Gotta make it funny. All right. So, the first cause of knee pain we're going to talk about is knee valgus. So, knee valgus is basically when the alignment of the knee is more inward. In other words, knock knee. Okay, so the main culprit in knee valgus is, other than your natural anatomy, is weakness of your glutes, glute med, glute max. That will cause uneven loading of the knee joint. So if you look at this schematic here, this is your femur, this is your tibia, okay? You're going to have increased pressure on the outside of the joint, okay? And on the inside, you're going to have increased tensile forces pulling at the ligaments on the inside of the knee. If you're an athlete during athletic movements, that means you can be more susceptible to ACL tears, meniscus tears, MCL tears as well. The next cause of knee pain we're going to talk about is IT band syndrome. IT band syndrome for athletes, this is more common with repetitive movements such as running, cycling, even going up and down the stairs. All right, and the IT band here on the outside of the thigh is tight. It's going to run from the hip to the outside of the tibia, and it's going to pull the tibia laterally or to the outside, and that's also going to result in some tracking laterally or pulling laterally of the patella. So that is also, just like knee valgus, going to cause uneven loading of the knee joint, as well as improper functioning of your glutes. Alrighty, now let's talk about some treatment. Okay. First things first, knee valgus. All right, we're going to want to stretch the TFL. Okay, stretch your adductors on the inside of the knee so they're not pulling the knee inward, and we're also going to want to stretch our hip flexors, deep in the groin. That goes from the lumbar spine into your femur. Okay, now for strengthening, we're going to want to strengthen our glute med right here, our glute max, so that they can pull the leg back outward. All right, external rotation as well as some abduction. Okay, improve your hip mobility so that when you are making those athletic movements, that your knee your hip can move how you need to. Okay, and lastly, we're going to work on some core strengthening. All right, core strengthening is important in any lower body rehab because it's going to allow us to transfer those forces from lower body to upper body and upper body to lower body when we are making those movements. Okay, next we're going to talk about IT band. For that, we're going to want to foam roll our TFL again, and then the IT band. Like I'll do that, the IT band. All right, I'm gonna stretch our hamstrings, our TFL, and the IT band. Some people say you can't stretch it, but it doesn't hurt to try it. Then we're gonna strengthen again our glute med, glute max, and work on our core strength. I think you're starting to see a little pattern here. Okay, cool. Now, patella tendonitis. All right, we're gonna foam roll the quads. Get some extensibility through there so it's not pulling on the tendon as much. Okay. Strengthen our hamstrings, strengthen our quads with eccentric loading. Now, if you don't know what eccentrics are, that is the downward phase of, let's say, a squat. Okay, so this would be the eccentric phase of a squat. As you come down, you're going to come down real slow and get a real fast. Okay, that's cool. Now we're going to talk about isometric loading of the patella tendon with resistance. So isometric contractions are contractions in which your muscle is neither lengthening or shortening. So something like a split squat hold would be, I think I need some rehab myself, would be an isometric contraction. All right. Now, if you add resistance to that, let's say holding a dumbbell or a kettlebell, research has shown that time under tension for a tendon can be healthy for tendon strength and tendon health.
So here I'm performing some foam rolling to the TFL, which is a muscle that connects to the IT band and tenses the IT band to aid in hip flexion, internal rotation as well. And then if I just rotate a little bit more laterally, I'm getting some of the glute med. So now I'm performing a great hip stabilization exercise for the glute med called the DNS star. And as you can see, I'm really working the glute med and the glute max by extending the hips and pushing forward as I come up and controlling eccentrically as I come back down towards the ground. Another great one is this lateral banded side step that is really gonna put stress on the glute med as well as a little bit of quad as I come into this mini squat. And we're gonna go back and forth for 3 laps. This is great for hip flexor as well as core. I'm gonna do sliders, mountain climbers, bringing the knee up and then sliding back with both feet on the slider. This is really gonna work the core. Give this a try. If you're looking for a good dynamic core exercise, this is really gonna give your core a nice burn. Next, we're going to work on the quads by using this eccentric squat. So during the lowering portion of this exercise, we're gonna lower our bodies down on a 4 count. So starting from 4, 3, 2, 1 down to the bottom. This is really gonna build that strength in the quad to help with that anterior knee pain and address some of that patellar tendonitis. And usually this is done later on in the healing process when pain and tenderness have calmed down a bit, so it's more tolerable. Last but not least, we're going to work on a single leg wall sit. Now, I know people are familiar with the double leg wall sit, but the single leg wall sit is, you guessed it, twice as hard. So give these a try and let me know how you feel.
Okay. This is gonna cause, we're gonna have to cut that out. This is gonna cause, okay, where should I start from?
Go, Fee, go. Okay, Pat. He's not floating. It's just on one leg. Are you sure you want to use this tape?
Yes.